How can this system be fixed? In fact, you can even localize it and talk about your own country as Guru.
Trevor, I agree with the doctor that there are a lot of gaps that need to be looked at in the healthcare system of Kenya. First, I agree with him that there is inadequate funding, because I have worked and I had an experience working in the county government when the healthcare system was devolved. Sometimes you see patients going to the health facility that belong to the government. They can only see a doctor, and they are written a prescription sheet, and they are told to go and buy medicine outside the facility, maybe in the chemist or pharmacist outside, the commercial pharmacist outside the towns. So I think there is a problem, because the government is not supporting the healthcare system fully. There is inadequate and erratic funding. Yeah. Sometimes there are also shortages of personnel. If you look at what is happening in the county governments, there are facilities that are manned by one person. For example, at the community level, you find a dispensary manned by one nurse. If in case he has some businesses out, they will close the facility, and that community will not be served until that health personnel comes back. I agree with him that there are also specialized services that are not available at the county levels. You can find a hospital, say they can put it at the level 5, but you look at the services they offer, maybe they offer services at the level 3. So if they cannot access, they cannot be able to provide what is required, a diagnostic like the cancer, people from Samburu have to travel to Nairobi, and I think that happens in the whole of the country. So if the government can look at empowering and facilitating the health system, that in every county we have a diagnostic center, we have an emergency center, so that even before referring the serious cases to, for example, to Kenyatta Hospital, some kind of services or emergency has been attended at the county levels. So there are a lot of needs that need to be done. Also, in terms of personnel, we need also to change our attitudes for sure. Because as a health personnel, they go through a thorough training, and they know how to handle a case from the outpatient to the inpatient until that patient goes out. Yeah. So we need also to have a change of attitude within our healthcare workers. Okay. Sometimes I talk to some of them, and they seem demoralized, because you are a doctor, you want to do a procedure, you are not facilitated, you don't have the equipment. Sometimes they miss anesthesia, and it's really frustrating also for them. So it needs an overhaul, for sure.